Hi everyone, this is Miss Windsor. Welcome to our first lecture for Bio 122, Anatomy and Physiology 1. Today we're going to be discussing Introduction to the Body. A lot of these terms will sound familiar to you. You should have discussed them in your medical terminology class. Here's a list of the objectives that we'll be talking about for the first section of our lecture. We'll be identifying some terms and also talking about the levels of organization of the body. In addition to that, we'll be discussing body cavities. We'll be looking at some images of that. We'll also discuss homeostasis, negative feedback loops, and positive feedback loops. So first, let's talk about anatomy. Now, you're probably familiar with the definition of anatomy. Anatomy is the study of structure of an organism and relationship of its parts. Now, if you remember from medical terminology, anatomy, when we break it apart into its constituents, literally means to cut apart. Now, physiology, on the other hand, is the study of the function of those parts, and pathology is the study of disease. So when we're talking about the scientific method, one question I always get is, why is this important? The reason this is important is because the scientific method is the initial observations or results from other experiments that might lead to the formation of a new hypothesis. So when a researcher or a scientist or an individual is interested in why something might happen, in order to get the best results from their study, they're going to employ the scientific method. So what does that look like? Well, if you look at this chart right here, the scientific method begins with observations and previous experiments. So what has already been studied, what is already known about this particular topic? From there, the researcher is going to propose a hypothesis. If X happens, then Y. And then that will lead them to the design of an experiment. Throughout the experiment, the researcher is going to collect data, and after that data collection is complete, they'll compile the data and they're going to analyze that to determine what the results are. As humans, it is almost impossible to remove all bias because we all wear our own perspectacles, which means we all have our own way of looking at things. The scientific method helps us reduce that level of bias so that we don't interject our own values, cultures, experiences when we're analyzing and interpreting the data that we've collected. Lastly, what will happen is if we didn't get the results that we want, we're going to refine the study and go again. If we did, we're going to accept, and through time, as such experiments are replicated, that is how we establish theories. So if you've ever heard of a theory of relativity, all of those things have been tested again and again and again and yielded very similar results. That's how we get to a theory and then eventually to a law. Now, how does this relate to us as surg techs? One of the biggest ways it relates to us is because of something called evidence-based practice. Now, evidence-based practice is using the scientific method to determine which practices yield the best results. A good example of this is sterile technique. Sterile technique, the 17 principles and practices that we employ in the operating room have been tested and tested and tested, and over time we have proven that those 17 principles reduce the chance of contamination, reduce the chance of surgical site infections for our patient. There is evidence that those practices are the best practices. So levels of organization. Organization is the most important characteristic of the body structure and of any living organism. So if we start with the smallest particle, we're talking about atoms. So on a chemical level, we have atoms, which are the smallest components of matter, and those atoms join together to create molecules. If we take another step up, we're going to be looking at cells. Cells are the smallest structural units of any organism. Once we have a collection of those cells, we can call that a tissue. Those tissues combine together different types of tissues to form organs, like a stomach, like a liver, like a pancreas, like a spleen. And those organs work together to accomplish a specific job. For example, the respiratory system. The organs of the respiratory system all work together. They're a bunch of different organs, but they work together to accomplish a specific job. Here is a chart where you can see visually what we just talked about. Up at the top, hydrogen atoms, the smallest particles. We have hydrogen and oxygen. Now, 1 part oxygen and 2 parts hydrogen makes something that we're very familiar with, which is a water molecule. Right now, if we jump to the cellular level, here you can see 1 muscle cell. Those muscle cells connect together, those smooth muscle cells, to form a smooth muscle tissue. Now, when we take smooth muscle tissue and other types of tissues, that could potentially form an organ like the bladder. And then when you have a bunch of different organs like the kidney, the bladder, the ureter, all working together, they form a system. And in this case, the urinary tract system. Anatomical position. So anatomical position, you can see here, is in the standing position, feet facing forward, face facing forward, palms facing forward. Now, when we have a patient on the OR table and they're in the supine position, this is also referred to as the anatomical position. We want the arms to be, the palms to be facing slightly forward. We want to make sure that the legs aren't crossed. This anatomical position is how we always refer to the patient, and there's a bunch of directional terms that go along with that. Now, if you click on this image right here, it is connected to the Wiley anatomy drill. So I would encourage you to pause this lecture and take a few minutes to review the this image here on Wiley anatomy drill. This image is depicting anatomical directions. Again, if you click on the image, you can go to Wiley anatomy drill and you'll be able to practice or review your anatomical directions. Here you can see that the very top of this arrow, or the very top of our patient, is going to be considered superior, the very bottom inferior. The back is referred to as the posterior anatomical direction, or dorsal, which means to the back or to the posterior, and then to the front, anterior or ventral. Now, if we look at an extremity like the arm or the leg, you can see here, anytime we use the word proximal, that means we're closest to where it hooks on to the torso. Distal means it's the farthest point away. So the foot would be distal when we're talking about the leg, distal to the trunk of the body, and this top part, the thigh, the groin area, is going to be proximal. Same with the arm. Something that we use in the healthcare field is called the compass rosette. And the compass rosette is kind of like a compass that you would use to determine north, south, east, west. But now this is used to determine those anatomical directions that we talked about before, and you can see them listed here. Planes of the body. So you should have talked about this in medical terminology. The sagittal plane, the mid-sagittal plane, the frontal or coronal plane, and the transverse plane. So here's an image depicting those different planes. Here you can see those anatomical directions. Down here is that compass rosette that we talked about. Now this first picture right here is demonstrating the frontal plane or the coronal plane. Right now we are dealing with the coronal virus, and the reason it is named that is because coronal means crown. So if you can think of the crown going on your head, perhaps this will help that the coronal incision goes across the top of the head from ear to ear. All right, and that would also be that frontal plane or that coronal plane dividing the body into anterior and posterior halves. All right, now the next one up here is the sagittal plane, and the sagittal plane divides the body into left and right. Now there's two different ways we use this. One would be mid-sagittal, and mid-sagittal means we're dividing the body directly down the middle, equal parts left and right, and the sagittal plane could be anywhere dividing the body left and right into unequal halves. The one that you see down here that I'm circling now, that's the transverse plane. Transverse divides the body into top and bottom halves. So if you think about transverse moving across a plane, that might help you remember. And then the last one here is an oblique plane, and an oblique plane cuts the body or a structure into top and bottom halves at an oblique angle. All right, now let's take a look at the body cavity. So two different cavities we're going to talk about. The dorsal cavity, which is the dorsal meaning back. Remember, we just talked about that. So where the brain and the spinal cord is. And then the ventral cavity, meaning the anterior cavity, and that's divided up into a couple different sections. So the top section here above the diaphragm, that is referred to as the thoracic cavity. Then below the diaphragm, we have the abdominopelvic cavity. So abdominal cavity being the upper approximately 2/3, and then the lower portion of the cavity being the pelvic cavity. Some interesting little tidbits to remember is that the mediastinum is the space in between the lungs where the heart is located. The trachea is also located there. And the pleural cavities are the cavities that the right and left lungs are located in, these little separate sacs. Here you can see a lateral view and a frontal view of those cavities that we just discussed before. Here, this is depicting that mediastinal cavity right here where the heart lives and part of the trachea. This is the diaphragm dividing the thoracic cavity and the abdominopelvic cavity from one another. Below the diaphragm here, we see the abdominal cavity and then the pelvic cavity. And you can see that in this lateral view as well. Now, let's talk about abdominopelvic quadrants and regions. So on the left-hand side, you're going to see that the abdominopelvic cavity is divided into 4 equal parts. These are called quadrants. So the upper 2 quadrants and the lower right and left quadrants. And when surgeons or healthcare professionals are talking about the abdomen, they're going to use these terms to refer to where is the patient having pain, where are they having discomfort, those kinds of things. So important to know when we are talking about these quadrants, what is located in each quadrant. a part of the liver in the right upper quadrant, also a part of the stomach, the duodenum here, part of the transverse colon. This is also called the hepatic flexure here, where the colon turns by the liver, and then so on and so forth. Now, we can take these 4 quadrants and divide them up into 9 equal sections, and that would give us these 9 regions. Okay, so 3 right regions, 3 left regions. So the top left and right are the hypochondriac regions. Hypochondriac, you should know from medical terminology, meaning below the ribs. Below the ribs, okay? Moving downward, we have a left and right lumbar or flank region. And then the lower left and right regions are called iliac or inguinal. So let's take a look at the middle here. This one's kind of the easiest to remember, is the umbilical region. That's where the belly button is. Above that is the epigastric region. Remember, epigastric meaning above the stomach, and then hypogastric below the stomach. Body regions. This image here is also linked to a Wiley anatomy drill, so I would encourage you to pause the video at this point and practice those regions. We're also going to have a participation activity that will relate to these regions as well. Stay tuned for that. Balance of body functions. When we talk about the balance of body functions, we typically use a term called homeostasis, not to be confused with hemostasis, which is the stopping of bleeding. So homeostasis is the body's ability to regulate itself to a normal situation or to balance its body functions. Now, when we're talking about homeostasis, there's 2 types of mechanisms that the body uses to regulate and balance all of the functions that are occurring in the body. The first one is called a negative feedback loop. A negative feedback loop is similar to a thermostat in your house. So if you think about in the summer, whatever you want your air conditioning set on, say it's 72 degrees. I like 72 degrees, so I set my thermostat on 72 degrees. When the temperature in my house is 73 degrees, my thermostat is going to trigger my air conditioning unit to kick on and cool my house. This is a good example of a negative feedback loop. Once my house then reaches the temperature of 72 degrees, which is where I've set it at, the air conditioner will kick off. You can see that's kind of depicted in these 2 examples here. A good example of the body would be if we are cold. If the body is cold, the temperature of the body starts to decrease. The body senses that through a variety of chemical communications, and the sensors in your muscles are triggered to shiver. And that shivering is going to warm the body, and as the temperature increases and the situation is returned to normal, then the shivering will stop. Here's another good example of a negative feedback loop. Let's say we have some lunch. When we eat something, our body is going to start to break down that food, and glucose, which is a sugar, is going to be, the food is going to be broken down into various components, and one of those is glucose, which is a sugar. When our glucose level rises, the pancreas is triggered to release something called insulin. Insulin is a chemical that attaches itself to sugar or glucose and turns it into glycogen. Glycogen can then get stored in the liver, the muscles, and the fat cells until it is needed for energy later. So as this process is happening, glucose is being removed from the blood, and once the glucose blood level returns to normal, the pancreas will be signaled to quit secreting insulin. So opposite of that negative feedback loop is a positive feedback loop. Remember, the negative feedback loop, the body senses a situation that's not normal and reacts until the situation is set back to normal, and then that mechanism stops. However, the opposite is true with a positive feedback loop, and there are few instances in the body where a positive feedback loop is used. Negative feedback loops are more common. A good example of a positive feedback loop is when a baby is born. So when a baby is born, as the baby is pushed from the womb or the uterus into the birth canal or the vagina, stretch receptors detect the movement of the baby. Now, this stretch information is fed back to our brain, and our brain triggers the pituitary gland to release a hormone called oxytocin. Now, oxytocin travels through the bloodstream and to the uterus, and it's going to stimulate the uterus to contract because now it's time to push that baby out. The stronger contractions push the baby farther along the birth canal, thereby increasing stretch and stimulating the release of more oxytocin. The uterine contractions continue to get stronger and faster and stronger and faster until the baby is pushed out of the body and the positive feedback loop is broken. Oxytocin can also be injected therapeutically by a physician to stimulate labor contractions. If you've ever heard of a pregnant woman her labor being induced, that's what we're talking about here. However, they would give a synthetic form of oxytocin called Pitocin. This image just indicates normal fluctuations in the body. So here you can see that as a physiological situation occurs in the body that is beyond normal, that negative feedback loop or positive feedback loop is initiated. However, what happens as we age is this ability for the body to maintain homeostasis starts to decline. All right, and you can see right here, and this doesn't give an exact age, but you can see over time how once we reach this point, the body is steadily losing its inability to correct those situations that are going on in the body. Okay, well, that includes our lecture for Chapter 1, Introduction to the Body. I am looking forward to seeing all of you on our Zoom meeting. Make sure that you prepare your muddiest points, and I can't wait to answer them for you. Thank you.